Dr. Vikas Puri here, President and co-founder of Intelligent Health Group. We've been talking recently about making sure that we know what exercises to do to relieve tension on our joints, on our spine. In addition, especially as the back starts to get better, you're going to find that your back pain turns more to stiffness instead of any acute sharp pain. At that point, we go more into our stage 2 care, where our spine starts to be more in need of flexibility exercises, not anything just simply to take pressure off the joints, but more importantly, to continue getting even more levels of flexibility into it, and then getting ourselves ready and prepared for the next stage, which is going to be more strengthening all our muscles to stabilize our spine so the problem doesn't come back. So, as you know, as I've been talking about at Intelligent Health Group, we have our 3 steps of recovery, right? Our first step is just about bringing inflammation down. So those exercises are very, very gentle, like we talked about yesterday, whether it be child's pose or a knee chest exercise, a pelvic tilt, just enough to take stress off those joints. Next, now in that stage 2 care, okay, where it's all about correction, about improving your posture, we start with flexibility of the spine. So for flexibility exercises, I'm going to talk about some of the main key exercises that I recommend when it comes to flexibility. So why is flexibility important? As your muscles start to get stretched, more circulation gets into the tissues, it starts hydrating those tissues again, the muscles start to get lengthened, and there's less of a contraction. So there's less of a locking up of the spinal joints as well in this manner. You're able to get a lot more relief experienced at that point. And longer lasting relief with the pain not coming back as much. You'll also notice that you're able to do more. You're able to function better. In functioning better, that means you're able to do more. So you can actually walk farther, you can climb stairs better, you can actually bend down towards your toes more, you can lift things easier, lift things that are heavier, and start doing your recreational activities again. Perhaps you weren't able to golf and now you can actually start swinging and moving those hips. You can start getting more social again, getting out there, getting more active. And that's what it's all about. So it starts with flexibility. The type of flexibility exercises that I want to kind of show you are things like the hamstring stretch. I find this one to be very, very beneficial because when the hamstrings aren't so tight, you get less tugging on your pelvic bones. So I'm going to demonstrate that for you. These are your pelvic bones. Your hamstring attaches right here, okay, on your ischial tuberosity. And so when your muscles are tight in your hamstrings, it pulls this hip bone backwards, and this joint gets stuck. This is your sacroiliac joint. So it's very important that we release the hamstring muscle so this joint isn't getting tugged on. Remember, all our muscles attach on different joints of the body, different spinal structures. So if the muscles are tight, it locks up the joints. So let me demonstrate right now our hamstring stretch. The easiest way I would suggest to people usually is find a low step or a stair, and just bring your leg up onto it. Put your hands on your calves and just gently glide yourself down. Keeping your neck relaxed, feel a nice pull through the back of your hamstring, and just gently come back. Okay? And then you're going to keep repeating this for up to 10 times. You're going to hold the stretch for 5 seconds at least, breathing normally and coming back. If you can, then obviously sitting on one knee is good, and that way you can actually just gently glide yourself forward like this. So you're not doing it standing, you're not doing it with your foot on a stair step. You could just do it on the ground or on a bed, a firm bed. Ideally, slowly, you want to get to a point where you're able to pull on your toe. Hold 5 seconds, get a nice pull through the back of your hamstring, and relax. Again, repeating it 10 times over, and you can do it a few times a day even. The next flexibility exercise I want to show you is very, very easy to do, especially if you're sitting a lot through the day. You can just move your chair back, cross your one leg over, and push your one knee, keep your back straight, make sure posture is good, it's not rounding or hunching. And push your knee down gently. Hold that for a few seconds and then release. Okay? That's going to stretch what we call your abductor muscles, your TFL, your IT band here. Your glute muscles will get a nice stretch through them as well. It's good for sciatic type of pain as well as that lower back sacroiliac pain that we sometimes get. So you're going to again push down, hold it a few seconds, and release. Do it about 5 times, holding the stretching component for 3 to 5 seconds, and then do that both sides. Now, if you're not on your chair and if you're a little bit more flexible, you can do it as we do in yoga. It's called a pigeon pose. Okay, and the pigeon pose, you're bringing one knee straight forward like so, making sure that your calf is parallel to the table or in front of you. And you're going to bring your forearms down, and you're going to gently try to bring your other hip down, your other part of your pelvis down toward the ground, and slowly bring your forehead down onto the mat, onto the ground, or the table that you're on. Okay, that's a great stretch to pull, again, the glute, the IT band, TFL, and so forth. So that's the pigeon pose. Holding that stretch for, again, I would say at least 10 seconds. You could even stay there for up to 30 seconds, and repeating that 5 to 10 times on both sides. That will really, really help improve flexibility of your spine. So the pigeon pose, the hamstring, these are very, very, very good. The other thing that I want to show you is great, especially first thing in the morning when you're stiff. It's the sun salutation exercise that we do in yoga. And I mention yoga often because a lot of our patients, they ask about flexibility exercises, and I say, on YouTube, there's lots of exercises. You could actually just YouTube beginner's yoga, and even 10-minute yoga. You can just YouTube it. 5 minutes of beginner's yoga for flexibility, and you'll see simple things coming up, and you can just follow those things. That's what I like to do as well, first thing in the morning. The sun salutation then is where you would actually be able to stand. You would be able to bring your arms up and then just gently fall downward like a rag doll, and got a nice stretch into your full spine, keeping your legs straight so your knees are not bending, and get a nice stretch the whole spine. Hold that position for maybe 10 seconds, and then you can just come back up, extend back again, and then gently fall forward again, and just be a rag doll in that standing position with your legs straight. That brings a nice stretch to the whole spine. Wonderful for flexibility. We did talk a little bit about child's pose yesterday. You could take that and you could just go a little bit further with it, and that will also be great for improving flexibility. So again, coming on all fours, bring your hands forward, gently gliding forward, getting your forehead to touch the ground slowly, and now you can actually start to go diagonal with your left hand, go towards your right side, and get a nice pull, nice side bend. Hold it for 5 seconds, come back, and then do the same thing the other side. Pull, hold a good 5 seconds, and come back. So you're just going a little further with it to enhance the flexibility component with the child's pose. So these are some simple little things. If you did these things every morning or anytime you're feeling stiff, a few times a day in that healing process where now you've just gotten out of that acute pain, now the pain's more duller, it's more stiff, it's more achy, doing these will definitely greatly improve the way that your back is feeling. Okay. The other exercise, because it's more upper body, we've been talking a lot about lower body, but it works so well, is your pec stretch. So I always suggest going in a door frame, keeping your arms parallel to the ground, get right in on the door frame and just lean forward. That way all your upper chest muscles get stretched, just like so. You hold that for 5 seconds and you come back. Repeat that 10 times. That's great for the upper back, the upper part of the spine, and relieves a lot of tension in that area, especially where people are on their computers a lot and you're rounding your shoulders. If you're curious about what exercise would be best for you, please do take advantage of a chance to call our offices. Talk to one of our practitioners. There's no charge for consultations. We're happy to help and customize something for you. And even better yet, this month we do have our $49 complete assessment, consultation, and first treatment offer. You can take advantage of that for spinal decompression therapy, chiropractic, or physiotherapy with any of our providers. And that way we can actually do a complete assessment, find out the source of what the back pain is, and then put together a customized treatment plan for you, which will include exercises, which will then customize and actually tell you exactly which ones are best for you, for your condition, because there can be some variations with it. And we'll tell you when to do them and when, of course, not to do them, depending on the stage of recovery that you're in. So do take advantage. If you're interested, just comment below. Look forward to seeing you soon.